Okay, so if you can hear me, you can just type good morning. I can see Grace Edwards has just texted right now. If you can hear me, you can just text good morning on the chat box. So for today's session, we're going to have the topic on social marketing in advancing access to SRHR and services. And we'll be having two speakers who are invited for this session. And that is Andrew Nzioki, who's the trade marketing executive at Maristops, and Margaret Wanjiru, the call center coordinator at Maristops. So my name is Hezron Nyakin. I'm a pharmacist by profession, and I'll be moderating this session for today. So for our speakers, I think, is it Andrew who's starting with us today?
Yes, Hezron.
Okay. So I've just allowed you to share your screen, and I believe you can get started when you're ready. So for participants, as you listen, you can also just note down your questions somewhere. Then at the end of the session, we're going to have a Q&A where you'll have your questions responded to. Okay, welcome, Andrew.
Thank you so much, Mr. Hezron. Kindly confirm from my end that you can hear me loud and clear and that you can also see my screen.
Yes, we can.
Good stuff. So good morning, everyone. So as all of you have heard, my name is Andrew Nzioki. I work with Maristops Kenya as a trade marketing executive. And just a little bit of introduction about Maristops and the department that I work in, because I'm sure most of you, when you hear Maristops, basically what maybe comes to your mind is the many clinics that we have across the country. So also under Maristops Kenya, we have a commercial sales department, which ideally I would say it's a small pharmaceutical company, because in that department, commercial sales, we have products that we import abroad from other countries and also locally. And for those products, we distribute to pharmacies across the country, to our clinics as well, and to hospitals, both private and public. So when you hear Maristops, don't just have that assumption of just having the clinics, but remember, we also have that mini pharmaceutical company or commercial sales that we have our own products that we also sell to private pharmacies, private hospitals, and also public hospitals. So that's the department that I work in as the trade marketing executive. And of course, through my presentation, I'm going to show you some of the products that we have in commercial sales and Maristops Kenya. And you're working very hard to ensure that mini pharmaceutical company or commercial sales in the future, it becomes a big company, because you're working very hard to ensure we introduce new products, and we have a huge portfolio of products, which at the end of it all will mean for the organizations, for the organization, which is an NGO, even in the advent of diminishing donor funding, you can still become sustainable through commercial sales and selling of products to retail pharmacies, hospitals, and also the public sector. So that takes me to the topic of the day, which is social marketing in advancing access to sexual reproductive health and rights and services, part 1. So when we hear about social marketing, what ideally should come to our minds, right? And I'm sure some of us who maybe have done some little bit of marketing courses, you've had things to do with the 4 Ps of marketing, which ideally involve the product, price, promotion, and place. But yeah, so when we say social marketing, this idea involves using marketing principles and techniques to improve contraceptive access, choice, and use. Because of course, in the space of sexual and reproductive health, there are very many options that are available out there for patients, for clients, and the general public as well. So social marketing seeks to leverage marketing concepts to influence behaviors that benefit individuals and communities for the greater social good. And it uses behavior change theory, market research, and consumer insight to inform the delivery of health information, products, and services that are attuned to clients' needs, values, and preferences. Because again, when it comes to sexual reproductive health products or services, We have very many options out there. And of course, one service or one product might work for me, but maybe when it comes to someone like Hezron, it might not work for him. Maybe he has different preferences when it comes to these products. And so social marketing defines its program objectives and utilizes the following 4 fundamental elements of marketing mix, which I've mentioned, the 4 Ps. So there's the product. Are we having the right products out there? There's the price. How is our pricing strategy out there? Of course, bearing in mind when it comes to these commodities, we have some that are provided, let's say, for free by other NGOs or even the government. Then also there's the element of promotion of the marketing activities and the place, which is ideally the channels that we use to provide these services. So they can be pharmacies, they could be hospitals, both private and public. So the 4 Ps, they develop strategies that achieve this social marketing objective. And very key to note is this 5th P, which has to do with policy, just to support the 4 Ps. Because again, without policy, the 4 Ps cannot be successful in the market out there. And of course, when it comes to policy, this involves both formulation of policies and implementation of policies. Because you can have very good policies which have been implemented, which have been formulated, but again, when it comes to implementation, that implementation is not there. So it's important we formulate policies and then ensure those formulated policies are implemented to support the major 4 Ps. So the 4 Ps plus the 5th P, which is policy, can be defined as follows. The first one being the product. So product can be a good or a service offered to a specific market segment or priority group. Then when it comes to the second P, which is price, this has to do with clients' willingness or ability to pay, considering financial and opportunity cost and competition with other similar products. Because for these products, they are in different categories. So for different categories, they have different pricing. There are some which can have premium prices. Then we have other ones which can have more like affordable pricing. Again, when it comes to promotion, this involves communication or advertising about the product or service targeted to the segment or the priority group. Then the 4 P is the place. So place involves availability and distribution channels that we use to ensure we take these products to the target segment. And this, of course, is linked to the promotion channels. Then the 5th one, which is added now to the 4 Ps, which we've mentioned, is the policy. So it involves policy revision, adoption, and of course, implementation of these policies. So it's important to remember, when it comes to marketing, we have the 4 Ps, but again, when it comes to SRH space, there's the 5th P, which is policy. Very important when it comes to SRH, products and services. So social marketing makes contraceptive products accessible and affordable through private sector outlets. And when we refer to private sector outlets, we refer to all pharmacy outlets. They could be distributors, pharmacy distributors. They could be pharmacy wholesalers. They could be retail pharmacies. They could be supermarkets, because we have some products that we can even sell to supermarkets. We even have dukas and kiosks, because we have other products which are in the space of sexual and reproductive health that can be sold even through kiosks and dukas, right? So social marketing makes these products accessible and affordable through the private sector outlets such as pharmacies and shops, while using commercial marketing techniques to achieve specific behavioral goals. And why is social marketing important? So one thing that we find being important about social marketing is that it can be used to promote a wide range of methods, because under sexual and reproductive health, we have all of them. We have many options available. So through social marketing, you can promote all these wide range of methods. Number 2, and important to note, is improved access by using large private sector networks. So these products can not only be provided through the public sector, of course, through maybe public hospitals, through the government, even through the private sector. It's a huge channel which you can make these products accessible to our customers, to clients and patients out there. Then I think the most important thing is reaching undeserved young people. So through social marketing and of course, relying heavily on technological advancement, because that's where we find most of our young people. So through online channels, we can actually use social marketing to ensure we reach the undeserved young people who spend most of their time on social media. Then the impact of social marketing, one thing to note is increase in contraceptive use, because if we can increase awareness, if we can provide more information through various channels, we'll ensure we've increased contraceptive use. Then reaches youth effectively. Yes, we've mentioned that again through various channels that we can use to do social marketing. And especially if we can target those channels where the youth spend most of their time in, we can ensure we've reached this particular segment effectively. Then last one there is to help sustain family planning gains. This especially is important, especially for an organization like ours, which is Maristop, which ideally initially has been relying heavily on donor funding. But what happens if there's no donor funding? So through social marketing and commercial sales and selling of products and availing these products to patients, clients out there, actually organizations can generate revenue and ensure they can continue to become sustainable and continue providing these services, even if they don't have donor funding. So it's important to note that and to remember that. So we're going to take a small case study on Maristops and the approach that we've used to do social marketing. And possibly before we do that, kindly, because we even have doctors and pharmacists here in the name of Hezron. So I'm just going to take you through a product portfolio of Maristops Kenya, so that at least you have an understanding of some of the products that we have and we sell to pharmacies and hospitals out there. So at the top there, we have two products, which ideally are our core products. So Mariprist and Misoclear. So those two are the core products that we have in Maristops Kenya and in other Maristop international countries across the country. So basically, so those two. Then on the second column, we have three Avibela Backup Lifeguard. But of course, through the presentation, I'm going maybe to do a small presentation about the individual products. Then in the last category, we have Active Girl, Nuclein V, Ziffy Liquid, and MS Jelly. So going to the two core products, we mentioned Mariprist. So Mariprist is basically a combination of two ingredients. One is called mifepristone, and the other one is misoprostol. So it's just a combination of 1 tablet of mifepristone and 4 tablets of misoprostol. And for this particular product, it's indicated ideally for safe abortion and post-abortion care. And of course, it's a prescription-only medicine. So for this product, without a prescription, you cannot get it in any pharmacy. So you have to go see a doctor. They assess you, they give a prescription, or if maybe the hospital is stocking this product, you can get it from that particular hospital. So you didn't expect to buy this product over the counter in any pharmacy. And for that pharmacy to stock this product, the pharmacy, of course, has to be registered by the Pharmacy and Poisons Board. It's a highly controlled product. Number 2 is Misoclear. So Misoclear is just plain misoprostol. And as compared to the first Mariprist, which is a combination of mifepristone and misoprostol, misoprostol contains 200 milligrams. Okay, sorry, Misoclear contains 200 micrograms, not milligrams, micrograms of misoprostol. And for this particular product, has 3 major indications. Of course, one of them being post-abortion care in countries or in regions where we don't have the first product, Mariprist. Because for this Mariprist, it's not available in all countries, but we are lucky in Kenya, we have this combination. But when you go to some countries, they don't have this combination. So for countries that don't have this combination of Mariprist, they have this Misoclear separate. And for them maybe to provide safe abortion and post-abortion care, they have to combine Misoclear alone, then another product called mifepristone alone. So 2 products alone, but combined as compared to the first one, which is, I would say, it's 2 in 1. So apart from MisoClear being indicated for safe abortion and post-abortion care, it also has a wide range of indication, especially in public hospitals and maternity department, especially for induction of labor. So it's very widely used for induction of labor. Then also for something called postpartum hemorrhage. This is actually a heavy loss of blood, especially when a woman gives birth. At times, some women lose a lot of blood. So to prevent that, MisoClear has also that indication. Also in some countries, though not ideally in Kenya, it has been indicated for treatment or management of peptic ulcers. So MisoClear has that indication as well. But in Kenya, it's not approved for that indication. Then number 3, another product that we have in Maristops Kenya, and of course we do market this product through social marketing, is Avibela. Avibela basically is a long-acting reversible contraceptive, and the main ingredient in Avibela is levonorgestrel. So it's a slow-releasing IUS system. So contains levonorgestrel, 52 milligrams, and for Avibela, it's a 3-year hormonal IUD. IUD is basically intrauterine device or intrauterine system. So it's a 3-year IUD. Though we are planning, because studies are ongoing in other countries, to ensure we can extend this duration to 5 years, 8 years, or even 10 years. So very soon it will be available for those women who maybe want to space their children, or possibly don't want to have children. So for them, if they maybe they want a space of maybe 8 to 10 years, it will be available very soon. But for now, indicated for 3 years only, Avibela. Another product that we have is Backup. Backup is just an emergency pill, and the unique thing about Backup is it's just a single pill, just one pill inside. Because we find that in the market out there, most of the brands that exist, they exist as 2 pills. So we've been having debates out there on how an emergency pill is supposed to be taken, and I don't want to pose this question to the ladies here, because throughout my background working in community pharmacies, in hospitals, we used to say, take 1 pill immediately after, let's say, unprotected sex, then the other pill after 12 hours. But of course, it should not be more than 72 hours of that unprotected sex. But while working in pharmacies, I would see patients coming, clients coming to the pharmacy, they buy an emergency pill which has two tablets, then they take the 2 of them at once, right? So if they can take the 2 at once, efficacy will still be the same as compared to taking 1 pill, then waiting 12 hours, and then taking the other one, as long as it's not more than 72 hours. But of course, we've had guidelines from WHO, whereby they say for emergency pills, they can even be taken up to 5 days after unprotected sex. But of course, efficacy reduces as the days increase. So ideally, we should say the earlier the better, because if a lady has to wait, let's say, for 5 days, then they take the e-pill, then the chances of getting pregnant might be high. So Backup is our emergency pill, 1 pill product. So that's the unique thing about Backup. Then another product very excited is LifeGuard that we have in Maristops, Kenya. So LifeGuard is just a male studded condom. Yeah, so we have that as well in our portfolio of products. And of course, for this particular product or brand, the condom brand, that's where social marketing actually comes in handy. Because for the products that we've mentioned, all of them have to go through PPB, which is the Pharmacy and Poisons Board, for registration. Of course, LifeGuard being included. But for all the other products, they're heavily regulated by the Pharmacy and Poisons Board. It's not a product that, for example, the one that I've highlighted here, Backup, Avibela, and the products for medical abortion, you cannot go shouting about them, let's say in social media, in billboards. So they are heavily regulated by the Pharmacy and Poisons Board. So it's only in the condom portfolio segment that we can do things like billboards, that you can go to radio, you can go to TV, and even social media. So I'm going to maybe do a small presentation of what we are doing through this product, and through social marketing, what we can actually do with condoms. Then another product that we have in Maristops Kenya is Active Girl. It's basically evening primrose and some vitamins. So this is a unique product, especially for women or ladies with irregular periods, UTI infections, mood swings, and even cases of heavy bleeding during menses. So it regulates hormones. So we have this in our portfolio as well. Then another one that we have is Nuclein V. Apologies, I know I'm speaking so much pharmacological terms. So Nuclein V is just a combination of clindamycin, which is an antibiotic, and clotrimazole, which is an antifungal. So it's a 3-day dosing for mixed vaginal infections. It's a pessary, supposed to be inserted, not to be swallowed, right? Nuclein V. Then another one that we have is Zifi. So Zifi is just a combination of iron and some few elements like folic acid and vitamin B12, indicated for forms of anemia or blood loss. So it's basically a blood builder or a blood booster. Then lastly, we have a jelly as well, MS jelly, in our portfolio of products. And of course, MS jelly goes hand in hand in some cases with condoms, because we find that there are patients, customers, clients who want to use condoms with jellies. So we have a jelly as well. But also for MS jelly, it's not only indicated, let's say, for lubrication during, let's say, sexual intercourse, but it also has a wide range of uses, especially in hospitals, surgical instrumentation, during procedures. So for this product, especially MS jelly, it has a wide range of uses in hospitals as well. So not just for fun or pleasure. So some of the trade marketing activities or social marketing activities that we can employ for products that we have in the SRH space, and a case study of LifeGuard, which is a male-studded condom that we have in Microstop, Kenya. So through social marketing and marketing of condoms, there are some activities or approaches that can be taken to ensure awareness is created for promotion of such products or category of products, that is the condoms. So one of the approaches is in-bar activations, whereby brand ambassadors can be based actually in bars or outlets, whereby when revelers are having a good time, enjoying themselves in those bars, through brand ambassadors, they can actually engage those revelers and actually create awareness about safe use of condoms. Because when you talk about condoms, we not only want to talk about the pleasure component, but safety should come first when it comes to condoms. And then again, when it comes to condoms, safety, of course, is safety against infections like STDs, big one, HIV, unwanted pregnancies, So we've taken this approach to ensure we do in-bar activations all across the major towns in the country, targeting major bars in those towns and employing brand ambassadors to actually engage revelers enjoying themselves and actually creating awareness about safe use of condoms. So, the major towns, we've done all these in-bar activations, and of course, going to the festive periods, we plan to amplify these activities and to ensure we create more awareness about this category of products. And of course, for the young people, ideally, you'd expect to find them in these particular outlets. So that's why we targeted these bars, so that at least we can ensure we reach these young people and we create awareness about safe use of condoms. Then another approach we've taken is something called boda activations. Because in major towns across the country, boda has become a main mode of transport. So through engagement with these boda riders, having a one-on-one discussion with them about safe sex and how condoms can go a long way in preventing unwanted pregnancies and other infections, we've been able to engage these boda guys. And of course, when these boda guys are ferrying young people across the towns, mashinani out there, when we give them these reflector jackets and it's branded LifeGuard, it actually sparks a discussion, because you can imagine if I'm in a boda, then I see LifeGuard, then down this written studied for extra pleasure. I might be tempted to ask the boda guy, hey, what's this? Then from that, we can kickstart a conversation about safe sex, and how through condoms, we can ensure the safe sex. And of course, that will go a long way in preventing young people from having unplanned pregnancy, not unwanted pregnancy, because I was in another meeting whereby we were told we should deviate from saying unwanted pregnancies, but we start saying unplanned pregnancies. Yeah. So through these guys, we've been able to engage them in all major towns to ensure we can use them as an avenue to spark a conversation when it comes to condoms and the young people. Then another thing we've approached when it comes to social marketing and condoms especially is influencer marketing, because again, for the youth and young people, most of them will find that they follow actually most of these big influencers in the industry, in the music industry. So through these influencers, we've actually used some of them to ensure we spark a discussion on safe sex and how condoms can be used actually to push that agenda. So again, through use of influencers, and these guys, of course, affect some of the decisions that young people make nowadays. So through them, we can actually push this conversation going about SRH and of course, things to do with unplanned pregnancies and safe sex. So on the left there on my screen is Calligraph, the OG himself. Then on the right is Frasha. Frasha ideally because he's also been key, especially with his work when it comes to AIDS and WHO, because actually it's the brand ambassador when it comes to young people and things to do with AIDS and HIV. But of course, going to the festive periods, we are open maybe to other new influencers. So be on the lookout for the influencers that you are looking, and to ensure during the festivities, they'll be able to push this agenda as well for SRH and safe use of condoms. Then again, another approach is social media marketing. So through various social media channels like Facebook, Instagram, Twitter, TikTok, we've been able to use those channels to ensure we are available, and actually we can pass information to do with sexual and reproductive health to the young people, because of course, I'm sure most young people are available in, if not most, all, but at least one of these social media channels. So can be Facebook, can be TikTok, can be Instagram or Twitter. So through these channels, we've used them to ensure we create discussions, and actually we can get reach of young people and spark a discussion about safe use of condoms and the available SRH products and services which are allowed to be marketed on these platforms. So these are just posts that went live on Lifeguard Instagram and Facebook. And I would encourage you, if you get some time, if maybe you're active on various social media channels, you take a look on what we are doing with Lifeguard especially. And yeah, that brings me to the end of my presentation. I'm sure it was very short, but again, you'll imagine for us salespeople, we are very fast to do presentations and go to the trade out there to start selling, because we always have targets. So that's why we normally have very short presentations. Thank you. I'm not sure if maybe we have any question.
Okay, thank you so much, Andrew. That was a very good presentation, and I agree with you that salespeople are supposed to be very short. Yeah. So, do you have any questions from the participants? You could just raise your hand. Meanwhile, for me, I have a question, and it's basically on the marketing channels that you guys use. So, which channel do you find being the most effective in advocating for the use of family planning, in your experience?
So the channel that we found to be most effective and most impactful actually is one-on-one interactions with various stakeholders. So this can be doctors, can be pharmacists, can be pharmaceutical technologists working in pharmacies. So that has been most impactful and has had has been most effective. Also through conferences, when these professionals are having their, let's say, annual scientific conferences. So through such conferences, we found them to be very effective, because we get an opportunity to address a big audience of key opinion leaders. So we've worked very hard to ensure we can tap into such annual scientific conferences through various professional bodies. So for example, for pharmacists, if you're having your annual scientific conference for under PSK, of course, the one that, for example, like the one you had last month, we were able to tap into that conference and to ensure we can actually engage those pharmacists on a one-on-one discussion when they're having such conferences. For doctors, especially for under KMA, and are very important for ops gains when they're having their annual scientific conference under COGS. We are very keen and we ensure we sponsor those conferences so that we can engage those key opinion leaders who influence decision-making when it comes to reproductive health. But also to mention social marketing has been also very key, because at times we find, especially for the young people, they like to hide behind their screens. So they'd rather, let's say, send a WhatsApp message or maybe send an inbox on Facebook or Instagram on inquiries to do with family planning services. So when it comes to clients, we've seen social media has played a huge role when it comes to disseminating information. But now when it comes to healthcare providers, we found that one-on-one discussions and of course those conferences have been a key channel of disseminating this information.
Okay, thank you so much for that response. There's a question here by Muthoni. Are the products sold through Maristops or can be purchased in pharmacies? I think that's something that.
But it's a great question. So what we normally do as Maristops, we are actually the suppliers. So we supply these products to pharma distributors or wholesalers, who then are supplied to their retail pharmacies. So that's how our route to market looks like. So for Maristops to pharma distributors to pharma wholesalers to retail pharmacies. But again, we've had instances whereby retail pharmacies want to buy direct from us, because when they buy direct from us, there's a small bonus or discount they get. So the price might be favorable when they buy direct from us. But for them to buy direct from us, they need to have an account with us. But for a sole individual, like let's say Muthoni wants to purchase these products from us, the right channel to use would be the nearest pharmacy. Or if maybe that channel is not favorable to them, they can actually source this product through our contact center. They can inquire about this product through our contact center, which is always available to answer those queries. And if they place the order actually can be delivered to them through our contact center.
All right, thank you so much. Is there anyone else who has a question that would like to ask? You could just raise your hand. Okay, I see there's no other question. So meanwhile, just as an icebreaker, for those who've joined us, you can just type hi and maybe say where you're joining us from. So meanwhile, the person who was presenting was Andrew Nzioki and is the trade marketing executive at Maristops. And now on, we're moving to Margaret Wanjiru, who's the call center coordinator at Maristops. Margaret, if you can hear me.
Yes, Hezron, I can hear you. Good morning, everyone.
Good morning.
Let me just share my screen a moment.
Okay. So meanwhile, I can also see there's a question from Josephine, but we'll look at that at the end of this session also. So Margaret, you can carry on.
Okay, can you see my screen?
Yes.
All right, fantastic. My name is Margaret Wanjiru, and I'm the contact center coordinator. So basically what we do at the contact center is we advertise on social media, and then we also respond to clients' questions on social media and even on call. I'm an economist by profession, but then I've worked with the contact centers for the last 7 years. All right, I'll let this session to be very interactive because what I'm going to present is something we do on a daily basis. So kindly, if you have any question, you can feel free to raise your hand and Hezron will let me know. And we will start. So I'll take you through social marketing in advancing access to SRH products and services. This is part 1. Part 2, you'll have the session next week. So simple definition, what is communication? We all know what communication is. Communication is sending and receiving information. So when you're communicating with anyone, always make sure that your language is clear and simple. Use a language that is understood by everyone. So what we do at MSK when advertising on social media, we always make sure that the language we use is simple. And when you're communicating with youths, avoid using a lot of English. Remember, most of our youths prefer Sheng, so you can mix English and Kiswahili. And remember also Kiswahili is our national language. So it's always good to include our youths and teenagers when advertising on social media. So use a language that is understood. Remember, when you use a lot of English or a lot of jargons on your social media pages, then you may be chasing away the youth. And remember, we are trying to also focus on the youth because they are also our clients. Also, again, avoid using a lot of words when advertising. Instead, use images because people don't read, especially the youth, they don't read a lot. They prefer visuals. So use a lot of images and less of words. The golden rules in communication, I'll just name them. You always need to communicate early and often. Yeah. So if you have an offer, don't communicate the offer in the morning. You won't get clients. Yeah. Start advertising at least 1 week before, or you can even do it 2 or 3 days before the offer day. And then tell them everything, or then don't tell them anything at all. So if you're advertising anything, make sure you always include, everything on that particular post. Much as we are trying not to use a lot of words, make sure that the visual or the image, captures everything that you want to tell them. Okay. And then before you do the adverts, always empathize with your target audience. All of us, we always want someone, whom we feel that they care or, they're there for us. So before you advertise, make sure that you empathize with them and then you communicate. When you commit or when you offer something, yeah, you always need to deliver on the commitment you advertise. For example, if you tell people on social media that you're going to have an offer of a particular product or service, make sure it's true. Otherwise, they'll never follow you or they'll never get to your page to read anything because they'll always assume it's a lie. So always deliver to your commitments or offers. And then something else that is very important is you need to choose your media or your channel wisely. We are going to talk about the different social media channels in my presentation. So when you're choosing a media, make sure you choose it wisely. For example, if you're advertising for, a job advert, you don't want to do it on TikTok because that will be somehow useless. You can choose a media like LinkedIn because that way you'll be able to target the older generation or, people who are a little bit serious, So always choose your media wisely. So what is social marketing? Okay, social marketing these are the approaches we use to develop activities aimed at changing or maintaining people's behavior. So we use social media to try and change people's behavior. Yeah. So what we usually do at MSK is we use social media to convey SRH information to our youths. Yeah. Remember, when you're doing social media adverts, avoid using acronyms. So if you're advertising or doing an SRH advert, avoid using SRH in any of your adverts. Write the name SRH in full. Otherwise, the youth will not understand what SRH means and they will go away. So always use simple and clear language when advertising on social media. And then something else that is important under social media is you need to know your target audience. Whom are you targeting with your messaging? Yeah. Is it, are you targeting a particular community? For example, if you're doing the female FGM issues, so that means you may be targeting the Maasai. So it's just an example, the Maasai as an example. So on social media, there's a way you can target them. You don't have to target the whole country. Just customize your adverts to target a particular community. And then customers, if you're selling something like Andreas, when he sells his products, he has to customize or he has to target his clients, okay? You can also have a target audience under politicians or customers and professionals. Those are just examples of target audience. Remember, we are trying to change behavior. So when you're trying to change behavior, you have to, number one, look at what people are doing. Get to understand, you know, why are they doing this thing? Remember, you have to empathize, yeah? So number one, you always have to look at what people are doing. And then try to understand or examine why they do it, yeah? Before you try to influence them. So look at what they're doing, examine why they do it, and then you influence their behavior, and you can actually incentivize or give them an offer to try and change their behavior. So why is social marketing or social media so useful? It's very useful because majority of the Kenyans, actually 2.2 million of all Kenyans at least have a social media account. So it's very important, and you can see the statistics. Last year, from last year to date, we've had an increase by 25%. Yeah, that is the number of users using social media. It has increased by 25%. So that means it's you know, a market that we need to always be keen in. Social media has been proved and we've actually seen that it can influence people either positively or negatively. And that's where we come in as MSK, because we want to influence them positively, especially surrounding family planning myths and misconceptions. We use social media to, you know, try and explain some of these things, because most of the people are usually on, you know, social media. So social media gives us the ability to showcase our products and services and improves the lives of our current customers, right? And I'll pose a question to all of us. Do you know any social media channel? Do you know any social media channel? Maybe you can use the chat bot, or if you're brave enough, you can raise your hand.
Media channel, yeah, yes.
Yes, Modoni.
TikTok and LinkedIn, Facebook, I think is for general, and Twitter.
Perfect.
Yeah,
that's good. And which one do you use personally? Which one do you prefer using?
For when I'm posting content in relation to what I do, mostly I do it on Twitter and LinkedIn. That is professional work. And then for fun and just crazy stuff, I do it on TikTok.
Exactly.
On Facebook, I'm not that active on Facebook, because I think on Facebook I have to be more careful on what I post there, because I think it's general, and I think a lot of people, even the young age, can be able to access. So I don't use Facebook that much to post a lot of stuff. But Twitter and LinkedIn, I do it for what I do in relation to my work. And then for Pinterest, I use Pinterest when I want to create something. I get some ideas in Pinterest. Yes.
Good, perfect. Thanks so much, Modoni. You actually said it all. I can see on our chats, people have written. Thank you so much for your contribution. And I'll name just a few. I've seen you know more than I actually do. Let me go to the next one. So the social media channels, Modoni has named them, and I've seen them even on our chats. We have Facebook. We also have Instagram, TikTok, WhatsApp, YouTube, Snapchat, LinkedIn, Twitter, and we have Pinterest, yeah? So these are some of the channels you can use when you're trying to advertise. And I liked what Modoni said, you don't have to use all the social media channels when you're advertising, and I'll tell you why, okay? So quality is always better than quantity, yeah? Always choose at least 1 or 2 media. You don't have to use everything, yeah? Because remember, you have to be consistent, and you also have to, post regularly. So as I said earlier, always know your target audience. If you're targeting teenagers, for example, you don't expect them to be on LinkedIn. So an organization that is targeting teenage clients, then I don't expect their adverts to be more on LinkedIn, otherwise they're failing. They can use a better channel like Facebook. You can also use TikTok. And then the best part about Facebook is you can marry Facebook and Instagram. What we've done at MSK, we've linked Facebook to Instagram. So whatever we do on Facebook, it also appears on Instagram. That's a nice thing. So you don't have to, post on Facebook and then again post on Instagram. Then again, it also, you have to check your target audience. I'm not saying for us, Facebook works best, but then you never know, maybe for you, TikTok can work better than Facebook. So you always have to know your target audience before you advertise. So why are we targeting youths on social media? The reason why we are targeting youths is, by the time a teenage girl is 17 years, she has already used social media. So you can imagine, by the time she's 20 years or 25, she already has an account, yeah? She has an account either on Facebook, she has an account either on LinkedIn. And even in the morning when we woke up, I personally woke up and the first thing I did is I checked my Twitter account. So you can see social media has become, our daily norm. So that is why we usually use social media to target audience. And it's much cheaper to use social media as opposed to the traditional marketing methods. Because on social media, you don't even have to use money, and it will reach, as long as your content is consistent, it will get to reach to at least a wider audience as opposed to you moving around or, distributing pamphlets and etc. So by the time a teenage girl is 17 years, imagine she has already used social media. And it's an important part of socializing. So most of our teenage clients usually get to social media so as to talk to their friends. And that is now where we come in. As they talk to their friends, make sure you're there advertising, or you're there giving them content, you're there demystifying myths around family planning, etc. So that's where we come in. Social media can affect teenagers both positively and negatively. So we come in to influence them positively, because there's so many negative things happening on social media. Much as it's a good thing, it's also good to acknowledge that there are negative things happening on social media. So we come in to, try and demystify some of these things that are happening there. So there are things that we need to do on social media. Just a moment. There are things that, there are things we need to do on social media, and there are things we ought not to do on social media, otherwise they'll backfire on us, yeah? So one, we need to choose an appropriate media. As I said, you don't have to advertise on each and every media, just choose an appropriate media for you. And then use more images than words on your post, yeah? People don't read, they prefer, looking at nice things, nice images, otherwise they'll not come to your page. And then always have a call to action. A call to action is, yes, you've advertised, so what do you want your audience to do, yeah? Do you want them to come to your facility? Do you want them to call you? In every post, always make sure that you have a call to action. And then respond to their questions quickly. So if you're posting on Facebook, make it interactive, yeah? Pose a question to them and then always respond to what they ask you. Otherwise, they'll not come, yeah, because you never respond to what they ask. So you can see this is an example of, an advert we did on Facebook, and you can imagine this was just a free post, and it got to reach 1,331. It's a post for free. Okay, you can see it has more of an image. The image is bigger than the words, and the call to action. Maybe someone can tell us what's the call to action here. Let me read, and then you tell me the call to action. Yeah, the only sure way to know if you have an STI is to get screened. Don't be scared. We'll be with you through it all. Book your appointment today. Visit our website, and that's our website page. And then we are open on weekends from 8 a.m. to 5 p.m. What's the call to action here? Remember, I told you in every post, you need to have a call to action. What's our call to action here? Someone, you can either text or, and there's no wrong answer here. We are here to learn. So you can just tell me, what do you think is our call to action?
Can I go first? Or
Yes, as well.
Okay.
Yes, you can.
I think for this one, it's book your STI screening appointment.
Very good.
Right?
Thank you. Yes, that's right. Book your appointment today is a call to action. And then again, we've told them how they can book. They book through our website. Yeah. So you don't leave it blank like that. Book your appointment today. They'll wonder, hey, where are we booking? Is it on, or should I call, or how do I book? Yeah. That's why now we went ahead and shared our website page. So on your adverts, always have a call to action. Another very important point that I forgot to add here is if you have a company logo, make sure it's visible. Yeah, you can see the logo is on top. It's here actually on top at the top. Is it left? Yes, top left. Yeah, make sure it's visible. Otherwise, they'll not know the name of the company or something like that. Yeah. So the don'ts, we are going to cover the don'ts. Yeah. When you're advertising, remember we said avoid using a lot of words. Always, okay, there are people who focus on quantity over quality. Yeah, you're busy advertising on Facebook, on Twitter, on WhatsApp, status, everywhere. You're advertising everywhere, you'll go wrong. Yeah, always have quantity over. Your quality should always overcome quantity. And then being on all social media platforms is another problem. Choose at least one media. You don't have to advertise on all. And then using only landscape images and videos. When you're advertising, incorporate many things. You can use Canva, you can use images, you can use videos, incorporate many things when advertising. And then not uploading videos to social media platforms. So there are people who always just, when you're posting, just post a photo or something. Yeah, it's always good to always incorporate other things like, videos. And there are many things that these social media pages offers. Yeah, just explore, get to understand, and you'll have a better outcome. And then again, remember what I told you, when you're doing a post, always know your target audience, and then you target them. Yeah, there's a way you can target your audience, yeah, rather than just advertising blankly for the whole country. Not everybody is interested with your product. Not everybody is eligible for what you're offering. So just target your audience and then boost the correct post. Boosting is, there are posts, there are free posts you can do on Facebook or on Instagram, and there are those you prefer boosting. So choose the one that is appropriate for you. You can boost with maybe even 1,000, that will work for you, 1,000 or even 50,000. It all depends with your pocket. Another thing that the mistake that people do out there is they don't respond to questions on social media. Now, remember, when you do a post on Facebook or on Instagram, okay, I'm using Facebook so much because that's what we prefer. we've seen it work, especially for the youths. So when you are doing a post on Facebook, always make sure that there's someone there responding to the questions quickly. Otherwise, people get bored and they unfollow your page. So this is another example of a post. Do you think this is a nice post or it's a bad one? The maternity open day, 1 free OBGYN review. We are the best, look no more, free pediatrician. Do you think it's a good post or a bad one?
I think from my end, I'd say it's not very appealing. Probably they would utilize things like icons or something to make it more appealing.
Yeah, even Nancy said it. It's a very bad post. One, because you can see the logo is not placed appropriately. Some people may not even see it. I'm not sure if all of you have seen the logo. And then it has a lot of words. You've seen, I've just read number 1, and I couldn't go on because people don't like reading. And then you can see even, it's not clear. Okay, it's a maternity open day, then what? It's not clear. What's the call to action? It's not even mentioned. So it's not a good post. And that's the same view is what our clients will get to see. So when you're posting, always make sure that it's appealing. It has at least an image, a call to action, more colorful, This is a very bad post here. Don't do such a post in future. So the next one is, so in MSK, these are the channels we use. We mostly use Facebook to target youthful audience. And we have 3 Facebook accounts. One Facebook account, we usually use it for, the free family planning adverts. And then the other one, we use it to target the teenagers. So there we use more of Sheng. And then we have another one that is used to advertise our centers. And then, as I said, we've linked Facebook to Instagram. So clients are able to see the same images on Instagram and the same images on Facebook. It's important to do that because there are people who are in Instagram and they're not on Facebook. Yeah. And then Twitter, we also use Twitter for the mature generation. And then LinkedIn is mostly used for job adverts. WhatsApp is usually our call to action in most of the posts. So we don't use the rest so much because, as I said, you need to be consistent with what you use. And then the content you share, at least make it regular. Like on Facebook, we usually post on a daily basis. And that's the end of my presentation. You can see our Facebook account and our number is WhatsApp number I've shared just in case you want to test and see the kind of responses that you'll get. Any questions?
Thank you so much, Margaret. From the participants, any questions you have? I see Grace says, nice presentation. Actually, for myself, I also really learned a lot about the use of social media. So any questions from the participants?
Hi, Ezron. I think there was a question from Josephine earlier.
Yeah.
Saying at times the products are costly and may not be possible for these girls to purchase. What can be done to help get some at affordable prices? Now, I think two things can happen, and one of them is happening already. So through organizations like Maristops, what we're trying to do is to engage the public sector, of course, through KEMSA, which is the body that does procurement for all the public facilities. But I think that is changing. So every public facility will now have the freedom to purchase direct from organizations like Maristop. So through this partnership, I will be able to ensure these products are availed at subsidized rates to those public sector channels. But again, when it comes now to the private sector, I think that might be a challenge, because for the private sector, most of those guys are businessmen, and at the end of it all, they're just looking at their profit margins. But I think what we can do that, and I think this will be a call to action from our end, is to do something called joint business proposals or plans with these private sector stakeholders, whereby if we can come up with an agreement and maybe we give them these commodities at a subsidized rate, we also expect them to extend that hand to these young girls. So from the public sector, it's work in progress, but from the private sector, I think there's something that Josephine will look into and see how we can partner with the private sector to ensure these commodities can still be availed at subsidized rates to undeserved young girls who cannot afford these commodities. But that's a great question, and thanks for asking that.
Thank you so much. And I think the other questions we'd have is, do you work with institutions such as schools, like to do their training or something? Andrew? Like universities, do you have partnership programs where you do the trainings for them on the use of family planning methods and all that?
Yes, so when these universities are having, let's say, events, could be fresher nights, fresher weeks, or cultural week, for example, the way it happens in KU, they normally send this request to us, and we partner with them in such events to ensure we push our agenda of SRH. So that partnership exists between us and such institutions of higher learning.
Okay, thank you so much for that. So anyone with a question, you could just raise your hand or type on the chat. So for Margaret, there's a question on, for starters, do you have any learning platforms you could advise guys who have their own startup companies that they could use so that they can be able to manage their social media well?
Yes, there are very many free courses out there, and I'm going to share a link for Google. There's a very nice course on Google, and it's free of charge. So I'm going to share the link shortly.
Okay, thank you for that. Grace Edwards says, I've really enjoyed today's session. I'm a marketer by profession and the presentation is wonderful. Thank you for that. And Josephine also says, great presentation. Yeah, so I think as we wait for guys to maybe come up with questions that they could have in mind, maybe ask Andrew to share the life in day of a trade marketing executive at Maristops. What do you do when you get into office and till the end of the day? Like, what are the key things that you do?
Wow, thanks, Hezron. So possibly, maybe before I go to what I do, just a little bit about my background. So I'm an enrolled pharmaceutical technologist by the Pharmacy and Poisons Board. So I started off my career 10 years ago by working in a small community pharmacy in Thika. Then after that, I joined the Aga Khan University Hospital, the pharmacy department, where I worked for about 3 years. But the whole idea of sitting in a pharmacy, dispensing drugs 1 times 2, 1 times 3, take this after food, take this at night, I wasn't really challenging enough. So I wanted an area that at least would stretch my limits, and an area that would give more room for growth. So that's why I had this urge to join the marketing department or sector. So after the Aga Khan University Hospital in 2015, I joined a company called Reckitt Benckiser. And I'm not sure who among us know any products from Reckitt, or maybe I've heard about that company. Reckitt?
Yeah, for me, I've just heard about it.
Yeah. Just about, but you don't know about any products that they have?
Not really.
So I joined Reckitt in 2015, and some of the products that they have include products like Strepsils, there's Dettol, there's Gaviscon for acidity and reflux, and also Durex condoms. So I think while working with Durex, that's when I had this passion to work in the SRH sector. And last year, December, Maristops came calling, and of course, this position of trade marketing executive arose. And yeah, Jan, this year I found myself in Maristops. So like I said in my presentation, what we're trying to do in Maristop is to ensure we enhance our product portfolio so that in the near future or very soon, we become a big pharma company where we have many products that we can actually distribute locally and ensure we generate more revenue for the organization. So since I've joined Maristop as a trade marketing executive, some of the key responsibilities have been to ensure we do market research out there. We talk to clients, we talk to pharmacy owners, we talk to pharmacists, pharmaceutical technologists. And in the space of reproductive health, we try to identify the unmet needs in the society out there and how we can source for products that can close that gap of unmet needs in the society. So some of the key responsibilities have been trying to source for products that are in the space of sexual and reproductive health that we can add in our product portfolio. And of course, that involves process of launching new products, and launching new products is not easy because there's all those activities that go into the procedures of launching new products. So it could be looking for or development of brand names, trademarking them, designing artworks, taking these artworks to Pharmacy and Poisons Board for approvals. Then when you go to sourcing these products, if you have to source them, let's say from India or other overseas countries, you have to ensure for those manufacturers, those factories have WHO pre-qualification. And of course, at times it involves even the Pharmacy and Poisons Board actually going to that particular facility and doing inspection to ensure those manufacturers conform to PPP regulations in the country. So it involves a lot of stakeholders, both at regulatory and also key stakeholders whom we are planning to bring these products to. Then apart from that, as a trade marketing executive, is designing promotional materials, because when, of course, you have new products coming in, they require huge marketing support, because you can imagine bringing in a new product and you're not giving it the support that it requires, it won't take off very well in the market. So also my responsibilities have been designing these promotional materials, then again, take them to the Pharmacy and Poisons Board for approval, because in Kenya, you can't just bring a product, then you design those promotional materials and just take them to the market. They have to have approval from the Pharmacy and Poisons Board. It's very tough and very strict in Kenya. Then again, when it comes to interacting with various healthcare professionals during their annual scientific conferences, doing continuous medical education, is to organize such conferences to ensure all the required materials are available. And for the team that I work with, because I have medical reps or medical tailors whom are attached in various regions, is to ensure for any marketing support, any marketing need that they require, I'm able to offer that so that they don't say they're not selling because they don't have any marketing support. So I work closely with the sales team to ensure I support them from the marketing side in terms of giving them the support that they require to succeed out there in the field. Also, in terms of product training, especially if we have new staff coming in, key responsibilities to ensure for the new staff coming in, they're well equipped, they're well trained, and actually know the unique selling propositions about their products and how actually they're supposed to disseminate this information to different stakeholders out there. So part of product training is also key when it comes to my responsibilities. But at the end of it all, is also having fun while working, because you can see from the activations that we've been doing, the in-back activations, the Boda Boda activations, it's very fun. So just enjoying yourself and working at the same time. So it's very fun. And I've seen, we've also have a marketer in our audience. And yeah, welcome and join us at Marisop and the commercial sales. We need marketers who will come and support us launch these new products. Because also competition out there is very tough, so we need marketers to come and ensure we strengthen commercial sales. Thank you, Ezra.
Thank you so much, Andrew. Grace, I hope you've had this marketing opportunity. Yeah, then I think now I'll move to Margaret. Maybe you could share what you do on a daily basis and maybe some of your background as a call center coordinator.
Thank you, Hezron. My name is Margaret Wanjiru, and I did agriculture economics in Egerton University. I cleared in 2010. So from then on, I joined Airtel as an agent. I joined Airtel Kenya as an agent, and after 3 months, I was promoted to a back office agent. So as you can see, I never did anything on agriculture, or I never joined any agricultural farm or any economic farm. I went straight to contact center, and I really loved contact centers. And actually, I can tell you for a fact, I've never applied for a job outside contact center. So under Airtel, I worked for Airtel for 1 year. And that's when I got an opportunity in MSK, that is in 2017, and contact center back office. So I joined Maristops Kenya in 2017 as a back office agent. And after 3 months, I was promoted to be the coordinator. So I've worked with Maristops Kenya for, is it 4 years? Yeah, that's 4 years. And, I like what I do. We mostly advertise on social media. We pick those calls, and, we refer clients to our facilities for better observation. Yeah, I'm still looking for the link for the free Google link course, and I'll share as soon as I have it. Thanks.
Thank you so much. It's okay. So from the participants, I'd like to have maybe 3 people who could introduce themselves and say what they've learned from this session on social marketing. So anyone? I see Mugoni, your camera is on. You could introduce yourself, say what you do, what you've learned also. This is also like a free marketing opportunity for you. So
yes, my name is Mudhoni Kamau. I work for Utena Youth Organization. We are based in Viwandani, that is Makadara sub-county. And what I've really learned today, I was actually doing a bit of notes on the products that you sell at Maristops. And I think it is very important for us working with community, and mostly in relation to sexual reproductive health. Sometimes you can get clients who may need this product, and it can be so useful for them. So what I've really
I don't know if we've lost her. Is it just me on my end, or?
Yeah, I think we lost her.
Okay, so maybe we could have someone else meanwhile. Mudhoni, if you can hear us.
I'll go next.
Okay.
Good morning, everyone.
Good morning.
My name is Grace Edward, founder and project officer of Chanua Dada, that's Chadala. For me, this has been very, very informative, because as a human rights defender, I identify as a human rights defender. There's this aspect also of marketing that I've learned today in the products and services that we offer as Chadala. So for me, this has been very interactive, because when it comes to SRHR, I didn't know that we also have something called like marketing. You can actually, market SRHR and the services that are there and the products that are there. So this has been a very wonderful and informative session for Chanua Dada. Thank you so much.
Thank you. Thank you so much, Grace. Who's the third person? So meanwhile, maybe someone can tell us the 4 Ps, if you remember, the 4 Ps of marketing. You can just text or raise your hand. What are the 4 Ps of marketing? Actually,
Product,
there are 5.
price, promotion, place. Product, price,
Uh,
promotion, place.
Yeah. And what was the 5th one that is very key?
Policy, I believe.
Yeah, that's right. Yeah, so I think that's all from my end. Maybe I could give an opportunity to Andrew and Margaret once more to just give a closing remark. So maybe we could start with Andrew. Yeah.
Yeah, thank you. Thank you so much, Hezron. And to the audience, I've enjoyed doing my presentation and interacting with you. And I look forward to more partnerships like I've heard from Grace Chanua Dada. I'm very keen to find more about what we do and to explore areas or avenues whereby we can partner and ensure we push our agenda of SRH. So let's keep in touch and see how we can partner moving forward. But thank you so much for this opportunity. I look forward to many more, if at all there'll be in the near future. Thank you, everyone.
Thank you so much, Margaret.
Thanks, Hezron, and thanks everyone for having me. I also enjoyed the sessions. You guys are very interactive. Thank you so much. And I've actually shared the link to the free course on Google. Just go through it. You'll learn a lot from it. Feel free to contact me if you have to. I can go through the contact center, MSK contact center, our toll-free number. I'll share our toll-free number as well as our WhatsApp number. So if you have any question, you can just call the toll-free number and you'll get to me. Thank you very much.
Thank you so much. So for Andrew and Margaret, I think maybe you could share maybe your email address or something on the chat box. Those would like to reach you. And yeah, and there's for everyone, I think thank you so much for joining this session. I believe you've really learned a lot from the experts. And for all those who've been following Maristops on social media, I think you've been able to see the consistency, good work that is being done by all of them. So I'd like to end the session by, I'll also say a little bit about what I do. I just completed my pharmacy board exams and I'm waiting to get into internship. And aside from that, I also do some work for agriculture. And aside from that, there's also a startup I'm working on, which is a health media and publishing company called Planet Wizard Africa. And we have a health magazine called The Health Anchor. So at the moment, we're doing our 6th issue, I mean. And I'd look forward to, I'd really like if you'll also share maybe your articles or something related to SRH, educating people and all that. Yeah. So thank you so much, everyone, and have a good day.
Thank you, Hezron. Good day, everyone. Bye. Say bye, Mama.
Guys, good day.
Bye-bye. Good day.